Hello, friends. Today we are discussing, do your hiccups disturb you? An Indian old wives' tale says that you get hiccups when somebody misses you. If you are able to name this person, the hiccups stop. How far it is true? What are hiccups? Hiccups are caused by involuntary contraction of your diaphragm, the muscle between your chest and abdomen, which are repetitive and uncontrollable. The muscle that separates your chest from your abdomen and plays an important role in breathing. This involuntary contraction causes your vocal cords to close very briefly, and which produces the characteristic sound of a hiccup. What are the causes of hiccups? Some common causes for the contraction include drinking carbonated beverages, eating a large meal, swallowing too much air or stress, eating spicy foods. The majority of persistent hiccups are caused by injury or irritation to either the vagus or phrenic nerve. Vagus is the cranial nerve and phrenic nerve which supplies the diaphragm. The vagus and phrenic nerves control the movement of your diaphragm. These nerves may be affected by irritation of your eardrum, which may be caused by a foreign object, throat irritation or soreness, goiter in the neck, gastroesophageal reflux disease, GERD, an esophageal cyst or tumor, all may irritate the nerves and give you hiccups. What foods trigger hiccups? The following may trigger hiccups: eating hot or spicy food that irritates the phrenic nerve, which is located near the esophagus; having gas in the stomach that presses against the diaphragm; eating too much or causing stomach distension; drinking sodas, hot liquids, or alcoholic drinks, especially carbonated drinks. Long-term hiccups. Hiccups that last longer than 48 hours, considered persistent hiccups. Last longer than 2 months are considered intractable or difficult to manage. These type of long-term hiccups are categorized by the type of irritant that caused the episode. Causes. Hiccups that last for longer periods can also be caused by misuse of alcohol, tobacco use, a reaction to anesthesia after surgery, certain classes of medications, including barbiturates, steroids, and tranquilizers, electrolyte imbalance, diabetes, kidney failure, arteriovenous malformation, a condition in which arteries and veins are tangled in the brain; Parkinson's disease, cancer, and chemotherapy treatments after that. CNS damage, central nervous system damage, that may lead to persistent hiccups. That includes stroke, multiple sclerosis, tumors, head trauma or brain injury, meningitis and encephalitis, which are infections that can cause swelling in the brain, hydrocephalus, or the accumulation of fluid on the brain, neurosyphilis, and other brain infections. What vitamin or mineral deficiency causes hiccups? The minerals include magnesium, potassium, calcium, and sodium, and vitamin B6. In most cases, supplementation with magnesium should be sufficient, but potassium and calcium should also be considered. Diagnosis, if intractable. The following test may be useful in determining the cause of persistent or intractable hiccups. Blood tests to identify signs of infection, diabetes or kidney disease, liver function tests, imaging of the diaphragm with the chest X-ray, CT scan or MRI, echocardiogram to assess heart function, endoscopy in which a doctor uses a thin lighted tube with a camera on the end to investigate your esophagus, windpipe, stomach, and intestine. And bronchoscopy can also be considered. Massage therapy. A doctor may perform a carotid sinus massage to help stop long-lasting hiccups. This involves rubbing the main carotid artery in the neck. Invasive procedures. Nasogastric intubation, which is the insertion of a tube through your nose into your stomach. Gastric lavage or gastric pumping, stomach pumping. An anesthetic injection or to block the phrenic nerve, which is located in the diaphragm. Surgical implantation of a diaphragmatic pacemaker, a battery-powered device that stimulates your diaphragm and regulates breathing. Possible complications of untreated hiccups. A long-term episode of hiccups can be uncomfortable and even harmful to your health if left untreated. Prolonged hiccups can disturb your sleeping and eating patterns, leading to sleeplessness, exhaustion, malnutrition, weight loss, and dehydration. How to prevent hiccups? There is no proven method for preventing hiccups. However, if you experience hiccups frequently, you can try to reduce your exposure to known triggers. Following this advice may also help reduce your susceptibility to hiccups. Try not to overeat. Avoid carbonated beverages. Protect yourself from sudden temperature changes. Don't drink alcohol. Remain calm and try to avoid intense emotional or physical reactions. Are frequent hiccups a sign of anything? Some illnesses for which continuing hiccups may be a symptom include pleurisy of the diaphragm, pneumonia, uremia, alcoholism, disorders of the stomach or esophagus, and bowel diseases such as hiccups may also be associated with pancreatitis, pregnancy, bladder irritation, liver cancer, or hepatitis. Is there any known benefit of hiccups? The common hiccup is a ubiquitous reflex. Everyone experiences hiccups innumerable times throughout their life. Unlike the other common reflexes like sneezing, which is clearing of material from the nasal passages, and coughing, clearing material from the airways of lung, there is no known physiological advantage of hiccups. Natural treatments. Take some granulated sugar, peanut butter, hot sauce or vinegar. Hold your breath. Drink water upside down. Paper bag breathing to increase your blood carbon dioxide. Dill seeds juice. Drink through a paper towel, which will take more time to drink. Honey. Natural treatment continued. Pressure point. Pull on your tongue. Press on your diaphragm. Squeeze your nose closed while swallowing water. Squeeze your palm. Massage your carotid artery. How do you get rid of with pressure points? Jaw point. Place your pointer finger in the small indent behind your jawbone here, just below your earlobe here. Gently press your finger towards your jawbone. Sorry. For 1 to 2 minutes as you focus on deep breathing. Sorry. Release this point. Should feel tender but not painful at this point. Natural treatments, things to eat or drink. Drink ice water. Drink from the opposite side of the glass. From where you are drinking, not from this side, from this side. Slowly drink a glass of warm water without stopping to breathe. Drink water through a cloth or paper towel. Suck on an ice cube. Gargle ice water. Natural remedies continued. Suck on a lemon. Put a drop of vinegar on your tongue. Tap or rub on the back of your neck. Poke the back of your throat with a cotton swab. Distract you with something engaging, video game, puzzle, or some calculation. Home remedies for hiccups. Breathe into a paper bag, just told to get more carbon dioxide in your blood. Eat a teaspoon of granulated sugar. Hold your breath. Lift your uvula, which is the fleshy piece of tissue that's suspended above the back of your throat, with a spoon. Attempt to purposefully gasp or belch. Bring your knees to your chest and maintain this position. Try the Valsalva maneuver by shutting your mouth and nose and exhaling forcibly. Relax and breathe in a slow, controlled manner. Getting rid of hiccups. Practice measured breathing. Disrupt your respiratory system with the slow, measured breathing. Hold your breath, inhale a large gulp of air and hold it for about 10 to 20 seconds. Then breathe out slowly. Hug your knees, compress your chest. Use the Valsalva maneuver. Thanks.